This video shows the dissection of cholesteatoma from the area of facial nerve and oval window niche. So this is a right ear and the atticoantrostomy has already been done. By default, all cases of unsafe chronic suppurative otitis media cholesteatoma should be scanned with a CT scan to identify any dehiscence of the facial nerve. Otherwise, also facial nerve dehiscence should be assumed in almost all the cases. Here you can see the epithelium is being lifted off with blunt dissection from the dehiscent facial nerve. Blunt instrumentation is required in this area, so to avoid any damage, and suctioning is being done continuously to look at the interface between the epithelium and the normal structures so as to keep the dissection in the correct plane. A whirlybird instrument is a very essential tool in removing the epithelium from hidden spaces, in this case from sinus tympani as well as the facial recess area, the suprapyramidal recess and the infrapyramidal recess. So the epithelium is being lifted up till the stapedius tendon, which comes into view briefly. We can also note the corda tympani, which is being stretched above. The suprastructure is palpated to check for mobility. The corda is dissected from the disease, from the epithelium. Every effort should be made to preserve the corda, and in this case it is being dissected off sharply from the epithelium using a blunt curved needle. We can see the tensor tympani tendon coming into view in the 11 o'clock position. Now the disease is taken off from the anterior part of corda tympani, and then we try to lift it off the stapes suprastructure as well as the promontory. The dissection of disease from the suprastructure is to be proceeded in posterior to anterior direction so that the stapedius tendon holds the suprastructure in place and any inadvertent dislocation of the stapes suprastructure is prevented. Here the epithelium is lifted off from the promontory as well as from the round window niche area. Effort is also made to prevent any damage to the middle ear mucosa that prevents adhesion formation between the new graft which is placed as well as the promontory. So there are various ways of dissecting of the epithelium from the suprastructure. Sometimes we do it by using blunt instrumentation. Sometimes it has to be peeled off gradually. The traction applied on the epithelium while removal should be very balanced and should not be so much so that the suprastructure gets dislocated off from the oval window niche area. And at a certain point of time, it would seem that that is the maximum effort that can be applied, and there are certain dense fibrous adhesions which cannot be easily peeled off. So these thick dissections can be, these firm dissections can be cut off with micro scissors, and the disease is now completely removed. Thank you.